As healthcare workers, we know hand hygiene is the single most important way to prevent the spread of infection. Just like the 5 rights of medication administration help nurses administer medication safely, the 5 rights of hand hygiene help ensure that healthcare workers have the cleanest hands when caring for patients. They include choosing the right product to clean hands, using the right amount of product, doing this for the right amount of time using the proper technique, performing hand hygiene at the right moments, and making sure the right people are performing hand hygiene. Let's briefly discuss each of the 5 rights of hand hygiene, and then we will provide more in-depth education into a few of these areas. First, you must choose whether alcohol-based hand sanitizer or soap and water are the right product choice for hand hygiene. The Centers for Disease Control and Prevention and the World Health Organization recommend washing hands with soap and water if hands are visibly dirty or contaminated with blood or bodily fluids, and recommend using an alcohol-based hand sanitizer as the preferred means of performing hand hygiene if hands are not visibly soiled. Second, you need to use the right amount of product. There is scientific evidence that supports the need for using enough product to ensure that your hands are adequately clean, which we will describe in further detail later in this video. Third, you need to perform hand hygiene for the right amount of time using the proper technique to ensure that you are effectively removing germs from your hands. We have included videos in this kit demonstrating proper technique. Fourth, you should perform hand hygiene at the right moment where patient care is provided and transmission of microorganisms is most likely. The WHO 5 Moments of Hand Hygiene focuses on these key moments, and the CDC guidelines describe key clinical situations where hand hygiene is warranted. The WHO 5 moments are 1. Before patient contact, 2. Before an aseptic task, such as starting an IV, 3. After body fluid exposure risk, 4. After patient contact, and 5. After contact with patient surroundings. The CDC recommendations align with the WHO 5 moments. Finally, it's important to make sure the right people are performing hand hygiene. In the past, the primary focus of hand hygiene efforts have been centered around nurses and other healthcare workers. However, patients and visitors also play a role in the transmission of microorganisms and should be educated on how and when to perform hand hygiene. Now, let's move on and learn more about a few of these areas. The right amount of alcohol-based hand sanitizer that you use to perform hand hygiene is very important. Think of it as a dose, much like a medication. Imagine that you have an infection and your doctor has prescribed an antibiotic twice per day to treat the infection. You do not read the doctor's instructions carefully and instead, you take the antibiotic once per day. You may receive some benefit from taking the antibiotic once per day, but you may not be achieving the desired efficacy that your doctor intended. The same is true of alcohol-based hand sanitizers. Manufacturers of these products should specify the right amount or right dose of product that is needed to meet Food and Drug Administration (FDA) standards for antimicrobial efficacy. The only current FDA-approved method for testing hand hygiene products is known as the Healthcare Personnel Hand Wash Test. This is a standard test method that involves applying a specific amount of bacteria to the hands, using the product being tested in a standard method 10 times with sampling at washes 1, 3, 7, and 10. The FDA requires products to achieve a minimum 2 log reduction after the first use and a 3 log reduction after the 10th consecutive use. What's a log reduction? A log reduction is a term that refers to the reduction of germs relative to the starting concentration. To explain it further, a 2 log reduction means the number of germs is 100 times smaller, and a 3 log reduction means the number of germs is 1,000 times smaller. Therefore, if you were to start with 10,000 bacteria on your hands and use a product that achieves a 3 log reduction, then you would have just 10 bacteria remaining on your hands. Let's go back to the example of the antibiotic. You've taken half the dose of the antibiotic to treat the infection. You are not achieving the desired outcome of treating the infection. Much like the antibiotic, alcohol-based hand sanitizer must be used at the correct dose. Otherwise, the correct germ kill will not be achieved and hands can transmit germs. The GOJO dispensers on your wall release 1.1 ml of product, the exact amount of PURELL Advanced Instant Hand Sanitizer needed to meet FDA efficacy requirements, so there is no guesswork in determining how much you need. With some products, you may need to use more than one pump of product to obtain the correct amount needed to meet healthcare personal hand wash requirements. Some products require an amount the size of a golf ball to achieve efficacy. The importance of using the right dose can be demonstrated in the laboratory. In this first picture, a laboratory worker with hands contaminated with the bacterium Serratia marcescens placed his hands on an agar petri dish that allows bacteria to grow and be visualized. You can see the heavy contamination of Serratia from his hands, which appear red in color. The laboratory worker then used 0.6 ml of PURELL Advanced, which is an incorrect dose, roughly half the amount of product that is actually required. He then placed his hands on another petri dish. You can see that many bacteria remained on his hands even after using PURELL Advanced, because he did not use the right amount of product. In this next example, the laboratory worker contaminated his hands again with Serratia, using the same technique, and placed his hands on the petri dish. As you can see, the agar is heavily contaminated with Serratia, much like in the last example. He then used a 1.1 ml pump of PURELL Advanced, which is the right dose that meets healthcare personnel hand wash requirements. After using the correct amount of product and correct technique, you can see that very few colonies of Serratia remain. And the white colonies of bacteria that remain visible are normal, healthy bacterial flora of the hands. But you can see the dramatic difference between using 0.6 ml and 1.1 ml of product. Just like a medication, it is critical that you use the right dose of alcohol-based hand sanitizer in order to achieve the desired outcome, which is adequate reduction of germs on your hands.